lure, and get our youth into addiction, and therefore creating a demand for their lucrative supply. So our commitment moving forward is that we will use the outcome of this survey to tailor drug prevention guidelines, to create awareness, to do positive parenting, because these youth are under the guidance of their guardians, to capacity build across the multi-sectoral space, to initiate and agitate for policy and legal reforms. And in this context, we want to extend the 300-meter rule to affect or to be also applied in our tertiary institutions. In conclusion, ladies and gentlemen, as we launch this report, let us remember that the future of our nation lies in the hands of these young people. And as I alluded earlier, within the demographics of the young people, those who are in tertiary institution form the apex. These young people are talented, they are innovative, they are full of potential. But if we don't act decisively, that potential could be lost to drugs and substance abuse. This is a call to duty. So let us roll up our sleeves, get to work and work together. And with those many remarks, it is now my pleasure to invite you to this official study. Thank you.
Thank you very much, CEO. Members, can we appreciate the CEO? Let's appreciate him once more. Okay, as we wait for the CEO, have some interlude. Kayamba Africa, some short interludes, or the DJ at the back. So, I did not introduce myself. My name is Patrick Obura. I'm the Director in charge of Corporate Services, NACADA. I'll be the MC for this session. I'll be assisted by our sign language interpreter, Madam Belinda Ochola, seated on my left. Thank you very much. Kayamba Africa, short presentation. As Kayamba Africa does the presentation, African Nazarene University students can be on standby to give us a short presentation.
Habari gani ndugu yangu, habari njema, lakini wewe kabila gani? Kabila langu ni Kenya. Kwa nini unasema hivyo? Mimi ni Mkenya. Kwa nini unasema hivyo? Sababu mimi ni Mkenya. Tupendane wa Kenya, tuunge mkono juhudi za amani. Ukabila tuache, kabila letu sote kabila tuhitaji nchini Kenya.
Kongole wana Kayamba Afrika, mgeni wetu wa heshima. Itifaki zote zazingatiwa, mabibi na mabwana. Tunataka kuendelea na ratma. Wakati huu ningeomba wakufunzi kutoka chuo kikuu cha Afrika Nazarene waweze kutupatia presentation kidogo. Tafadhali, asante. As we wait for the students, Kayamba Africa, or they are coming.
Unasemaje sasa mbebezi? Maradaza mashoke. Si unasikia ni Valentino alafu sasa mbebezi. Nakupanganiaje? Nakupeleka date Nani? Nataka tu nikufanye design sijafanya mbebezi wangu mwingine. Unani diglo? Relax, acha sasa nikuchapie. Nataka nikupeleke base. Zako nilikuwa hai. Unaningam? Nataka nikupeleke base. Noma sana. Nakupeleka Glovo bebe. Unaenda. Na sino Mariam sasa.
Lakini bebe. Wataka kunipea nini? Flowers ama mzinga?
Sasa kwanza tuanze na maua bebe.
Sivyo? Unajua buda, sipendi maua, hiyo pelekea nyuki, nataka mzinga.
Nimekudigo sasa. Unataka nipelekee nyuki maua, ndo nikuletee mzinga. Nimekudigo.
Sasa mbele. Unajua kisho ni mbali.
Baby.
Na nimeona badala ya kupatia flowers, nikupeleke kwetu maua tutakula mbele.
Kweli kabisa baby. Alafu Pepe, unajua ni promise tukitoka hapo tu hapa utanioa.
Hiyo ndio nikwambia. Hiyo usikwe na maneno mingi.
Kweli Pepe. Alafu pia unajua Kikuyu na Mkamba ni kiukamba. Sasa mtoto wa Mluya na Mumeru atakuwa
si mtume. Ni mwanaume.
Kweli.
Unanipata?
Kweli baby. Umesema ukweli. Lakini pia anaweza kuwa Mumeru.
Hapana. Si Mumeru. Ni Mumero.
By the way.
Wewe tuache mambo ya mapenzi. Na mko na mapenzi mingi. Nataka kwanza tukuze kati. Unajua mada majafika kuja haraka wewe. Wewe unajua kwanza mimi nataka niwakadaje. Kitu mtashinda ni njaa peke yake. Shika kwanza umevalia manyu. Shika zako.
Unaongelea hivyo.
Wacha nikuonyeshe. Mimi nataka kuwakanyaga wewe. Kwanza kwa sababu ni wakati wa mapenzi nipatie haki.
Torea hizo. Hadi mwanaume nikupatie haki. Itakuaje na niko na mbebeza hapa. Wewe piga top shoulder. Bebezi ni gani halo? Give flowers.
Unaitishaje flowers mkuu wangu? Huyo ni blind pass.
Sasa nyinyi, badala ya nyinyi na mbele sasa, mimi nataka kuwaletisha flowers. Wewe tisha mbele bana. Patia kijiko.
Kijiko gani bana? Mimi siko shikisha.
Na maanisha spendi.
Spendi gani?
Spendi.
Angalia ile inaonyesha mambo ya mapenzi.
Na nilijua hadi apende msupa wake. Ati spendi.
Haya, sawa. Kwa sababu naona mko na ujinga. Nataka niwasainie kama Diamond na Zuchu. Wacha nionyeshe. Kula bili.
Halo, ati nani? Hamna. Okota 5. Halo.
wewe.
Eh.
Siwe ni mzee situkule tu.
Kweli baby.
Lakini sasa wacha tufanye.
Eh.
Maana hapa tunamtufanyia. Sasa nikuonyeshe. Kicking back. Kicking back. Reverse. Backing up. Hapa maswali.
Ai.
Kwa sababu uko na jokes mingi sana. Pia joka
Hata ndio mmoja
Ai, ngoja hadi mimi siona venye game imeenda. Ai.
Na mkono gani baby? Na mkono gani? Hello.
Yes, mheshimiwa. Nilipokea, niliona confirmation asubuhi. Thank you very much for the donation. To improve rehab to facility tutake kara.
Madam, umesikia umesema confirmation. That's me to will add my salary.
What have you done to this facility to demand a payment? You know you think it's here.
Yes, my name.
Sikia nikipiga honi. Nimepiga honi, nimepiga karubeta, nimepiga triumph. USA wamesema yes.
Madam, unajua mimi ni caretaker. I am supposed to take care of everything.
First of all, take care of us. Rock brain for sure.
Lakini madam mambo sana.
Na wewe kuja. Ensure you talk to those students. Unaona? Wasiponilipa sita. Basi hata unaona. So you ensure you talk to them. Makas kagao, uko smart. Wow. Uko na potential. Ensure you become a good university counselor kama mimi, si ndio? Work hard, you can go. Tuende.
Ladies and gentlemen, can we applause the students? Very enlightening. Chief guests, ladies and gentlemen, all protocols observed because of time.
I want to take this opportunity to welcome my colleague, Professor John Muteti, to do the presentation of the report. Karibu Bwana Muteti.
Thank you. The CS Interior, Chair Nakada, board members present, CEOs and VCs invited, the media and other stakeholders. I think this will be very short, Bwana CS. This is the study on the status of drugs and substance use among university students in Kenya. And this study, as the CEO said, is a collaboration between several universities, 17 universities. And we had our objectives, which basically were to look at the preference of the DCU among university students in Kenya. And we wanted to establish the extent of alcohol use disorders. This is things like addiction. We also wanted to look at the risk factors and the consequences of DCU among university students in Kenya. We wanted to assess the extent of depressive disorders and also to establish the existing strategies which may be used. We had a methodology which I think the CEO also went through, and we are looking at both the public and the private universities. 17 of them were selected, 30% of the chartered universities in Kenya. There was a sample, and the sample was 15,730. We had a very good response rate of 99.7%, excellent. And I think this is because it's the students themselves who took part in that, in the data collection and things like that. Very quick background on the characteristics. Of course, we had the private and the public. We also looked at the male and the female students because they exhibited different characteristics. We looked at the years of study and also where the students reside, and the numbers are given there. We have the findings on availability and accessibility of drugs and substance of abuse. Availability and accessibility. We're asking the students, are these drugs available? How available are they? How accessible are they? How quickly can you get them if you want? And this is the availability of alcohol, tobacco, and cat. These are the numbers we got. Most of the students say at 87.3%, they say it's very easy to access alcohol. And the numbers are there for cigarettes, 64.4%, For shisha, 41.2%, and you can see the availability of other substances of abuse. Miraa and mukuka were also accessible, at high numbers at the universities. They could easily get them if they walk out the university environment or surroundings. They would easily get them. Now, there is the availability of narcotic drugs, and cannabis is one of the critical narcotic drug which has been giving us a lot of problems, especially in the universities. And we found that 61.7% of the students felt that they can easily access narcotic drugs, including cannabis, and especially cannabis. We also have cannabis edibles, a new thing which is coming up where you can have the edibles, you can do a cake, you can do something, and you can easily take it. You can even do a juice. There's a cannabis juice. So somebody would think that you are taking some soda or something, yet what you are taking is really cannabis. And the numbers are shocking because, nearly 50% of students felt that they can easily get them if they want to. Then, of course, we have cocaine and heroin. These are potent narcotic drugs, very, very potent. And 15% of students felt that if they wanted cocaine, they would really easily get them. If they wanted heroin, they could easily actually get them within their environment or wherever, from suppliers and so on. Then we have other drugs like prescription drugs at 13.9%. We have inhalers. We have codeine. Codeine, you can get this you can get this from the chemists very easily because it's used for mafua flu and things like that. We also have other smaller narcotics which are also very, very lethal. Methamphetamine. We also have ecstasy, and we also have ketamine. Very, very dangerous. Some of these, are used in the hospitals, and they said that they can access them if they wanted to. There are other psychoactive substances. Sorry, we have already done that. Then the sources, where are they getting them from? We were asking them, where are you getting this? Where can you access this? And we found that the teaching staff, 7% says that the teaching staff can supply them or supply them. Very, very important thing to understand. If the person who is teaching you, the lecturer, can sell that, how dangerous would that be? Then also from parents, meaning that when the parents are at home, they are smoking, they are taking alcohol, they are putting it in the fridge, the student will take it. And even some of the parents are taking these drugs together with their kids. 20 inches, you are now big, a university student, they can go there. Also important. Then the non-teaching staff, 14%, and you can see the website. You can get it online. Even the canteens within the institution, 28%. And that's why the CEO said that this issue of the 300-meter rule, which we are only saying is for the basic institutions of higher learning up to Form 4, is not really helping much. We should extend this such that if it is an institution of higher learning, then the availability of these drugs like alcohol, whatever, should not be allowed within that kind of environment. And that is an important issue. Online, social media, the online. We also find people selling it, very low regulation. Because if you go to Jumuiya and all those other people, you get them selling alcohol. And we don't know who they are selling to. They may be selling to somebody 10 years because there is no proof of identity, there is nothing, they are out there to make money. So how are we going to make sure that these online websites and so on are not allowed to? And I think our chair and our CEO, through our parent ministry, have really pushed for legislation to make sure that these are really not sold through the social media. Then the fellow students from within the universities, you know, the students, there are students who are, and I know we have lecturers here, who have been repeating year in, year out, you know, and they don't do it because they are not very sharp. They are doing it because it's a business they are perpetuating there. So you find that somebody is supposed to have finished university 4 years ago, and yet they are in their 7th year. What are they doing? There must be something they are doing, you know. And I think that from the university themselves, there is something which we need really to look at so that they don't continue selling this. And then, of course, the neighborhood. And this was very critical. You can see the neighborhood at nearly 60%. The canteens, the bars along, you know, within the universities, they are the most dangerous. They are the most dangerous. They are the ones where the drugs are found. They are the ones, and we have the people, the university professors who did the research are here. And it was very clear. They would say that even the students were telling them that there is this vehicle which comes every Thursday. I don't know if it was a white one or a black one. But it brought a lot of queries. And I think because the AG is here, maybe they would give that information. And it is coming every Thursday, and they don't know. So it is supplying and supplying and supplying. So that is also critical. And of course, the peer pressure from friends. And friends from, you know, are actually supplying this, either from within the university or from outside there. Now, the preference levels. We want to look at the preference levels, and we can look at the alcohol and tobacco products. When we look at the levels, we find that the private universities are doing a little bit badly vis-a-vis the public universities at 23.4% vis-a-vis 16.4%. You know, there was a perception that the private universities, well, I'm sorry to say, are Christian, too much, you know, very, you know, regulated. But the opposite seems to be true. Actually, I'm not saying anything about that, but this is the data. So you see, the public universities seem to be doing quite well, relatively. The sex, also, the females are catching up. That perception that really drugs is a male problem is really not there. You can see the ladies actually competing, you know, very aggressively, you know, at 15.7%, and you know, the national university rate is 18.6%. We may want to note that the national average is around 11.6, 11.7%, meaning that is a lot happening in the universities vis-a-vis the national average. And you see the cigarettes still following the same thing, maybe shisha. For shisha, I would point out that the female seems to be overtaking the male. Female seems to be preferring shisha, and you can see the numbers for the shisha as far as the females are concerned. And I think you can see the numbers there, Bwana CS. I don't need to belabor a lot because we have it in our report. We did some survey, Bwana CS, on primary schools pupils. We did some survey on secondary school students. Now we have done survey on the university students to complete the process so that we know what happens after you leave primary to secondary and so on. We also did survey on the employees in the public sector and the general population, which is the general survey. And we can see the comparison there. Very, very shocking, because once these students leave secondary schools and they go to the university, something seems to be happening. I mean, I think maybe the environment or the freedom they have or lack of checks and balances, something seems to be happening, because you can imagine from secondary, 18.6%, now they start using at that level. And this is a very high number, because these are the people who are going to go to the employment, you know, they are the ones who are going to get employed. And the general population has 11.8%, as I said, for alcohol. And you can see we are, doing very badly at that area. Something needs to be done, in this area. When we look at CAT, and I think this was a very odd issue, CAT, because, of course, it's a livelihood for some people, and somebody may think that, but as for us, we are just being professional and giving the situation as it is, and I think our board said, just do what you can, give the numbers. And you can see we have the Muguka and the Mira. The Muguka is the more potent. And if you look at the Muguka, you find that more of the university students are really using Muguka vis-a-vis the card. Muguka is more cheaper. It's a 50 bob, you get it very, very quickly, and you can take it. Mira, I believe, will be more expensive. More affluent students taking Mira. But all the same, we find that at least 10% of the students are either taking Mira or Muguka. And in our rehabs, we find that in Muguka, many of the students, and even the general population, are getting more addicted to Muguka. We are continuously admitting them in these rehabs. And therefore, it becomes also very expensive on our part. The narcotic drugs, the ad drugs, the numbers are not very high because they are in the range of 1%, 1.8%, and so on and so forth. But which came out very strongly is about the cannabis, the cannabis. The cannabis is quite high, and quite a good number of students are taking the cannabis. And the male and the female are, just more or less taking the same numbers. The private and the public, still not much difference. And you can see this challenge of cannabis is that we have the 2% national, rate population. In the whole country, cannabis is like 1.9%. But at the universities, it's 10%, meaning that 5 times, when they are in the university, they are likely to take cannabis 5 times more than the general population. What is happening there? Meaning something is happening. And these are the ones who are going to transit to the national population, to the general population, rather. Heroin and cocaine, not very big numbers, but still critical. Critical because if you start taking heroin, this is just a case of addiction. You are just addicted. You can't take heroin 1, 2, 3, 4, a month and say that you're going to be free. And I think our experts are here. They will tell you that you just take it, you'll just be hooked. If you look at the setting, and I think I've talked about this, where you can see very high at 10.7 vis-a-vis the general population, and I've seen it. We did a survey on the employees in the public sector, and you see that they are also a challenge there. Now we have other psychoactive substances, including prescription drugs, and we've seen that they are also being used. Though at very low numbers, but not as very low, because if you are saying 1.4 are using a particular product, like codeine, then we need to look at that space, because these are things which you can buy over the counter. Others are new psychoactive, products, substances which can be manufactured in the lab or elsewhere. And I think the DCI, and ANU, did a very good job, and they're doing a very good job because they are really getting these labs, out there in the bush, in the parks and everywhere. And I think with the collaboration of NACADA and so on, a lot is being done there. But that capacity that they can go to the chemist, the pharmacist, and buy them over the counter without any prescription is also a challenge which needs to be looked at. So if we look at the ability, the people who are using at least one drug, either you are smoking, you are using cannabis, you are using heroin, whatever, we find that 26.6% are doing that. This is nearly 30%, a third. 1 out of 3 students, or maybe 1 out of 4 students, are actually using one drug or the other. If you take university students here and 4 of them are seated there, 1 of them is likely to be using that drug. It is a worrying trend. Now, the consequences. We had so many consequences, and in our report, Bomas, you get we have the consequences there. Some of the ones they gave us were that most of them were really not doing very well in exams. 47.1% is nearly half. You are hooked in drugs. The likelihood that you are not going to pass your exams, to sit for your exams, is nearly half. You see? Quite dangerous. Or you miss classes because you are either high or you have not taken your lock or whatever it is, 36.5%. And you have issues with the institution, either disciplinary or whatever, which is nearly 40%. We also had the consequences which were reported when we did the focused group discussions. A lot of these things now came out. And some of them were, of course, the absenteeism, which we said. Most of them don't complete their degree programs in time. A lot of violence, a lot of mental health disorders, depression, the addiction we have talked about, increased cases of sexual harassment, rape, and planned pregnancies. And these are real. They told us that this is what is happening. And they were speaking through experience because, these are the students themselves, being interviewed by their colleagues, not by strangers, being interviewed by their colleagues. Now, the extent of alcohol use disorders, this is the addiction. What are the levels of addiction? Now, we found that the severe addictions, like, for example, the alcohol, addictions, the severe addictions, these are people who are supposed to be in the rehabs. There is a low, there is a moderate, and there is the severe. Once it is severe, it means that you cannot function without this drug. You cannot function without it. And therefore, you are a candidate for a rehab. And we found that we have, in the public universities, we have 9.5 vis-a-vis the private universities, 9.5, 8.3 in the public universities. For the male and female, or 10.5% and 6.5%. Of course, as the year of study progresses, because of the use, you are likely to have more of the candidates for rehabs going to the 4th year students. But generally speaking, 8.5% of the students in the universities should actually be in the rehabs. That is nearly 1 out of every 10, nearly. 1 out of every 10, they are supposed to be in the rehabs. And this is in comparison with the national average, where we are saying 5 out of 100 are supposed to be the rehabs. The general population in Kenya, like 1.3 million. Those are the people out there, and those are the kind of rehabs we require. 1.3 to cut off 1.3, and our rehabs are hardly 200. Even the public ones are very low, very few rather. The private ones are about 200 to 300. So it's really something which the government, NACADA, and the government and other institutions, especially the county governments, because that is their mandate. The county governments should actually do something about it. We have already talked about this, the comparison, where you find the university students. The employees in the public sector are not doing very well, and I think sometimes because of the disposable income, they are taking a little bit more, because when they are out there, and we have been discussing it, how best to help these employees, especially in the public sector. In conclusion, Bomas, we found that there are high levels of availability and accessibility which must be addressed. Because if it's available and accessible, then the temptation is there, and it will be easier just to move outside the compound and they just find the bar out there, and the drugs being out there, it's a motivation. That's the environment. Cannabis, mostly commonly used, is especially in the university. Use of online platforms also discussed. Emerging use of cannabis edibles. These are the cakes and things which are sold around. The study also showed increased vulnerability among both male and female students. That divide is now blurred. It's no longer as it used to be. The female and the students, the same. That myth about private and public universities, who is doing what, is even not there. These students are really doing more or less taking these drugs. And those students who reside at home or are accommodated outside seem to be badly hit. It's something to think about. The ones who are, at the end of the day, they are walking out, going home. Still parents are there, remember? Their parents are there, but still they are taking. The ones who are accommodated outside in the private, residential, areas, they are still taking, as compared to those who are within the university institution. And also the self-sponsored students. We can imagine these are people who might be having some money. So, and they are, maybe it's their indisposable income. Now, there was also an emerging penetration of the new psychoactive substances, which are being made at the labs and things like that. There's that, kind of penetration. And some of these students, we realized that are making these in their labs. The experts also are doing chemistry, whatever, they just make some of these things there, and I think it is something also to look at. The use of the university students themselves in the supply, I've discussed about this, because the students themselves seem to be the main suppliers of that, and I remember the team is here. The students from some of the universities, which I will not mention, who used to be frequenting other universities, and they were known. If you see such and such, something is happening. And I think these are things to look at. Very quickly, Bwana CS, the recommendations. The university management should take strong measures so that we can now roll out prevention and intervention programs, because we know that it's better to prevent than to cure. So if we start early, talking to these students and so on, we will save quite a good number. And also there was the recommendation that these accommodations, private accommodations outside the university, there should be a partnership between the universities and these private accommodations, so that there's some control. We talk to the students, we counsel them, we also make sure that wherever these institutions are, they are drug-free, so that you are not supposed even to smoke there, you're not supposed to sell drugs there and things like that. And that will also help in that area. The guidance and counseling departments are also wanting, and it was very clear that most of the universities, those who have, may only have one person. And sometimes it's just the dean of students, and maybe just one other person. And therefore, this is an area which needs to be looked at. The chaplaincies, they play a critical role, because we found that those people who bring the religious, people to talk to the students and so on, and those even students who are either, in a religion, either a Christian, Muslim, and so on, they seem to be faring well than those who are non-religious affiliated. And that's something which also came out. And therefore, we found that these chaplaincies are a critical thing to think about. The CEO talked about the 300-meter rule, which applies to institutions of basic learning. When we go for our enforcement, we find that, and in many of the universities, we find that it's just a bar outside. But they tell us, but you know, this is an institution of higher learning. You can't do anything. These are students who are over 18. And I think if we change that law, we will be able to protect a lot of our students. And actually, to make matters worse, some of these bars are within the institutions themselves. I know when we went to university, we had the student canteen, you can sell whatever. I would imagine, I don't know those times how it was, but maybe things have now changed. Because when you are there, you can access it, accessibility. So why are we selling beer? Why are you allowing them to be actually, even the licensing, the county governments shouldn't be allowed to license such. And then, of course, we had the challenge of parents. Parents seem to think that once their students are now, once their children are in the university, at the university, then that is not now their whatever anymore. It's not their bother. But we found that if really they are involved in the guidance of their students throughout their life, it will bring a lot of. We need to talk to these parents. We need to talk to them so that they don't leave this to the university management or to the to the other people. And I think, Buenos Aires, that is the end. But as I end, I would also want to appeal to the media, because we want to disseminate most of these reports, most of the alcohol and drug abuse-related messaging. We want to do it to the public, to the general public, and to the targeted groups. Media is very powerful. It's very powerful. We cannot do it without the media. Both the social media, the mainstream media, and all the kinds of media. Because when we do that, at least we will strengthen this fight against alcohol and drug abuse, and we'll be helping this country. We'll be helping this country. Buenos Aires, I think that is the end of my presentation. Thank you very much.
Thank you, Professor Muteti. Ladies and gentlemen, while Professor Muteti is taking his seat, chief guest, allow us to appreciate the team of researchers. So I'm kindly requesting if they can be upstanding. I know the lead is Professor Halimu Shauri. Just raise your hand, Professor. So can you appreciate all the team of researchers? Thank you very much. Because of time, allow us to make progress. Professor said in his closing remarks that the media is very critical. And at this juncture, we want to give 5 minutes to the representative of KEG, that is the Kenya Editors Guild, Mr. Wanyama Chebusiri, kindly. These are the folks that synthesize, chief guests, and disseminate these statistics to the public in the manner they do best. Karibu sana.
Chief guest, the CS, Interior, Murkomen, my friend, the IG, Douglas, Vice Chancellors present, NACADA leadership, and distinguished members of the press, ladies and gentlemen, habari zenu? You are so nervous, why? Okay, tusalamiane hewani? Yes. Can you tell your neighbor, use wisdom to fight drugs? Again? Yes. My name is Wanyama Chebusiri, and the Kenya Editors Guild was formed in 2004. It's a professional organization that brings together senior editors from the print, electronic, and online media in Kenya. It has a membership of about 500, and this membership comprises of practicing senior journalists within media houses in Kenya, and also it comprises of people who have transitioned from newsroom to academia to consultancy, like myself. And it also comprises of media scholars. There are many here. And before we proceed, can we have some of the KEG members who are here? Please stand up so that wawaone. Hebu simama popote mlipo. I know many of them here. Let's appreciate them. Yes. Many of them, today is World Radio Day. They're very busy out there, especially the leadership. And therefore, the main reason why the Kenya Editors Guild was formed is to defend and guard against media freedom. Also, to defend journalism in terms of professional etiquette, such that today you have to operate within the realm of journalism etiquette. And I've been given 5 minutes. I know the Kenya Editors Guild has performed its work, media performs its work, and as NACADA leadership rightly puts it, and even researchers, you can't do without the media. Can you do without the media? No, you can't do without, I know. But despite even the passing of the Kenya Access Information Act, the media faces very many challenges. Getting information, especially from government agencies, is a big dilemma for the media. Please, can that improve? 2, we have delayed responses from the media. A journalist calls and anaambiwa hapana, I'm not allowed to talk. And you know what? News is perishable. We need that information. And when you're not providing information, then I will say what I'll say, and then I say, when asked for comment, they said they are not allowed to talk. So, usilaumu media. Sawa sawa. Then there is one aspect. There is a lot of hostility against the media in the recent months. I know when I was a BBC correspondent, we used to be friends with Murkomen, my friend, sorry. A lot. I made him what he is, and I know he's a friend to the media. Please, situations, and my friend Kanja, situations where the media, journalists are beaten up, please let it be the thing of the past. Tell your neighbor, let it be the thing of the past. No, again, tell your neighbor, let it be the thing of the past. So that Murkomen, being a friend of the media, honestly, where you are globbering, a lady journalist, it should not happen. And lastly, I want to appreciate the role that NACADA is doing, especially in the fight against drug abuse. It's really doing a lot. When I go to my village in Western, we call it Msala. Who knows what Msala is? Msala ni ile bangi. And you know what? Villages in Western, they are rotting. People are not there. We are creating zombies. That as much as you are carrying out research in universities, please extend the same knowledge in those villages. When I go to my village, people are frustrated na wanakula msala. Hiyo msala msiwaachie. Lastly, what was my concern about the research that has been mentioned, especially the lead researcher? He says that among the people who supply are university lecturers. In my other life, after leaving the BBC, I share knowledge somewhere as an adjunct lecturer. Please, I can assure you, I'm not one of them. Thank you.
Ladies and gentlemen, let's appreciate Mr. Wanyama again. I know we have very limited time, chief guests. The universities were very important in this study, and they are going to be very, very important in the implementation of the recommendation. So, chief guest, if you can allow me to invite Professor
Thank you very much. Honorable CS, National Mulcomen, Inspector General, the NACADA Board of Directors, Dr. Reverend Stephen Mairori, and the board members here, and also officer of NACADA and the officers here, and the universities present, and all the participants. Good morning again. Today, and I said that I needed to know what is going on. And I also research is very, very important. Actually, the request to conduct this research. And when I received that request, I actioned the right person to actually. Congratulations to the NACADA team of our universities. One of the things that, and I think the previous speaker, was the source of drugs. And because I was looking at the numbers, because teaching, support staff, I combined them because they are all staff. And I think I was a little surprised because this, we as managing to our students. We wrote a few interventions that we are going to initiate. Recommended. Say that it's also surprising, and we have seen like the with our male students, but I'm surprised that now, because data does not lie, that the male and the female are actually at par. Again, another thing that we thought was, and we have been using that as a premise to make interventions, was that it is more of a problem with the public as opposed to the private. Again, results have shown something very, very different. And in our university, we had already started various interventions, and we have established a wellness center. We have regulations, and before a student is sent away because of abusing drugs, we actually get in touch with the guardian or the parent. And we allow them 1 week to go through counseling support, and they know that we are also available to support them. And there are many other interventions that we have put in place, including what we call a mental wellness month. So the whole of May, we actually do that. Several seminars with experts from the US and our collaborators. But what this research has done, it has given us impetus, it has given us data, and it has also told us now that NACADA has entered into our space, we are very, very confident that with your support and with your experience, we'll be able to safeguard and salvage our young people and our potential employers and our potential people that will actually get into the labor market. Thank you for this opportunity, and congratulations again. Let's not pack this data, let's go out there. And I'm so happy to the members of the fourth estate because we are partners in this. Thank you again.
Thank you very much, Professor. Members, can we appreciate Professor again? Chief guest, allow me also briefly to call the representative of the Vice Chancellor of African University, African Nazarene University, Dr. Simon Obwato, to give his remarks. Anu.
The chief guest, Honorable Onesimus Murkomen, Dr. Reverend Stephen Mairori, the chairman, NACADA Board of Directors, Mr. Douglas Kanja, Inspector General, all the Vice Chancellors, the CEOs present, members of the Fourth Estate, greetings to you all. I'm standing here a little bit disturbed by the findings, and very, very particularly, number one, as a representative of a private university, and secondly, as a lecturer. I'm told the lecturers are the ones supplying some of these things in some villages somewhere in Western region. I'm also Deputy Vice Chancellor of Academic and Student Affairs of African Nazarene University, as you've heard. So this is not a very good moment for me, but I want to believe that data speaks, and when data speaks, we have to listen. Isn't it? When data speaks, we have to listen. There is reason for that. Let me say that I stand here to represent our Vice Chancellor, Dr. Stanley Mahosi Bebe, and African Nazarene University. As you have seen, even the skit that was presented, although it was cut short, that was a skit presented by our students. Our students are so alive and awake to the realities of some of these things. I wish to take this moment to commend NACADA for this critical research. Indeed, this study is going to inform a lot of future studies, policies. I believe this is quite an opportunity. I'm thinking about the methodology that has been used, and as a researcher myself, I am impressed, and on behalf of African Nazarene University, I'm speaking in low tone that I'm giving NACADA an A+ for that study. That's a well-articulated study, and I think instead of arguing and defending ourselves, it's important that we take up the responsibility and we move on to challenge this issue. However, I also noted that the the religious aspect comes in to really moderate the situation, and I think that's an important element that we need to bring out. Also, something else that is very important, the 300-meter, outside of these universities, it's important that we think about how we are going to take care of this situation so that the housing, the private housings around the universities are taken care of. I think there's one thing that I would like to emphasize, and probably this will inform future studies. When we talk about drugs, we are not simply talking about addiction and all these things. We are also talking about the well-being of the students. Please note, and anyone who works in any university will agree with me, today in 2025, if you discover a certain student is doing drugs, remember, it is about also their mental well-being. You don't take it up and start vilifying that student. You have to approach it with a redemptive perspective. So remember, it is your responsibility. You don't vilify the student. How did they begin taking the drugs? Where were you as an institution when they started. I know there's also the issue of the society. And remember, students are an extraction of the society. So even studies as we go into the future have to focus on that. Let me make one important request. Even as we move into the future, I would like to request for increased funding in this area. And I know really there are challenges in terms of need for funding in different sectors of the economy. But this is a very important area because of one thing. Because drugs are indeed affecting the economic and social progress and success of our country. So we have to focus in these things. If we can deal with this, I'm sure economic growth can be attained in this country, because again, it's affecting the young people. This is the productive population. One last word, because again, I wouldn't want to take too much time. I would wish to urge the universities, if we could come together as universities. Remember, the VC of KU has just spoken. They have their own situation. But are we speaking to each other so that we can generate a situation where we can share the data, we can share experiences, and we can grow together? So those will be my remarks, and thank you very much for the opportunity. Please clap for yourselves for finding time to be here. Thank you.
Thank you very much, Daktari. Can we give Daktari another round of applause? Chief guests, all protocols observed, ladies and gentlemen. I want to take this opportunity now to hand over the program to the NACADA CEO, Dr. Anthony Omerikwa, to make progress. Karibu, Daktari.
Thank you very much, Obura. Without further ado, it is my humble duty to invite my chairman, Dr. Reverend Mairori, to give us his address. Thank you.
Our CS, Inspector General, and all our guests that have been invited, let me take this opportunity to do a quick introduction of our board before I'll share my speech. So if the board members can just come here to be seen and to be known. Karibuni, board members. If there's a microphone, just tell us your name and which institution. So, okay, to Pale. Yeah.
My name is Anjeri Mathu. I'm the vice chair of the NACADA Board of Directors.
Reverend Goge, NACADA Board Director, and also the National Chairman of Association of Pentecostal and Evangelical Church of Kenya, APEC.
Good morning. Dr. Josephine Etenyi, State Department for Youth Affairs and Creative Economy, alternate to the PS.
Good morning. My name is Veronica Okoth, representing the PS National Treasury in the board.
Good morning. I'm Samuel Laboso, the Director Anti-Narcotics, and I'm representing our Inspector General in the board of NACADA. Thank you.
Thank you very much. My name is Anthony Omerikwa again, board member and secretary to the board. Thank you.
Thank you very much. Let's appreciate our board members. Chair, this is an expanded board. We have, our CS, we have 15 board members. Several of them, because of other duties, are not here today. But since we do two critical functions, we have others like research, but the two supply suppression and demand reduction. And today, CS, with your permission, we do have the Inspector General of Police, who is actually a very key partner in the supply suppression part. I've had quite some meetings with him, and I'm very pleased as he is working with us on this matter, and we are very, very, very grateful. So allow me, sir, to invite the Inspector General just to say a few words, and then we'll proceed. Tumkaribishe Inspector General wetu aje atusalamie. Karibu sana. Karibu sana.
Thank you very much, Daktari, rafiki yangu. Our CS, Honorable Murkomen, the NACADA Chair, NACADA board members, the media fraternity, the members of the Fourth Estate, the university